Working on machinery without proper ventilation can be extremely dangerous. Take charge. Call out for help.
Hey, Dan, what's going on? Are you okay? What have you been doing? Help! I can use some help!
Assess hazards. Make sure the area is safe. Determine the number of casualties, what happened, and the mechanism of injury. In this case, because the machine has been shut off and the door is wide open, the fumes will not affect the rescuer. Assess responsiveness. If you're alone, place the casualty in the recovery position and call for medical help.
I'll be right back. I'm just gonna go get some help.
Place the casualty face up.
Okay, everything's gonna be fine. They're on their way.
Open the airway using the head tilt chin lift. Check breathing. Look, listen, and feel for no more than 10 seconds.
Okay. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000.
If the casualty is not breathing, pinch the nostrils. Make good seals at the mouth and nose and give 2 slow ventilations. Take about 2 seconds per ventilation. Check for signs of circulation, including a carotid pulse or movement, or coughing in response to the 2 breaths. Take no more than 10 seconds. Be aware that a pulse can be hard to find. If you are not sure whether there is a pulse or not, do not delay. Begin CPR. If signs of circulation are present, but breathing is not effective, continue artificial respiration. Give 1 breath every 5 seconds.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
Blow with enough force to make the chest rise.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
Recheck for breathing and signs of circulation after 1 minute and every few minutes after that. Continue giving artificial respiration until the casualty starts breathing again, medical help takes over, another first aider takes over, or you're too tired to continue any longer. If the casualty starts to vomit, turn him on his side, clear the mouth, and check breathing.
Let's see if you're breathing okay now.
If the casualty is breathing, assess the rate and quality of breathing. Check for shock by checking the skin temperature and its condition. If he is breathing on his own, place him into the recovery position to allow drainage from the mouth. Reassure the casualty and loosen tight clothing.
I'll be right back.
Cover him to preserve body heat. Reassess the ABCs: airway, breathing, and circulation. Record the casualty's condition and any changes that may occur. Record the first aid given.
Everything's gonna be all right.
When medical help arrives, give the attendants an oral report about what happened, the casualty's condition, and the first aid given. In summary, begin with a scene survey. Assess responsiveness. If you're alone, place the casualty into the recovery position and call for medical help. Place the casualty face up. Perform a primary survey. Open the airway and assess breathing for no more than 10 seconds. If casualty is not breathing, give 2 slow ventilations. Assess for signs of circulation for no longer than 10 seconds. If you are not sure whether or not there is a pulse, do not delay. Begin CPR if trained. If there are signs of circulation but breathing is not effective, begin artificial respiration, giving 1 slow breath every 5 seconds.
After 1 minute, recheck for breathing and signs of circulation.
If the casualty starts to vomit, turn him on his side. Clear the mouth of vomitus and check breathing. If he is breathing on his own,
Assess the rate and quality of breathing.
check for shock. Place him into the recovery position. Give ongoing casualty care. Reassess the ABCs. Record the casualty's condition and any changes that may occur. Record first aid given.